I think that sometimes even when I go to the doctor with my own kids, I often feel like there's this like wall, it's like there's this wall. Okay, this is another person coming to the office. Okay, here are my questions for you. The doctor will ask me the questions, and then that's it. It's so impersonal. Medical care, healthcare has become so impersonal.
Super excited today. We're going a little off the course, but not really, as you'll see. I have Dr. Ashley Rosenbaum here. She's a pediatric dentist. As you can see, her office is absolutely gorgeous. And we're gonna have some fun talking about everything under the sun, what she does, and what she likes to do. So anyways,
cool.
Thank you for joining me,
Hey,
Dr.
thanks
Rosenbaum.
for having me. I always love chit-chatting with people.
Dr. Rosenbaum is like the most personable dentist I've met in a long time. You guys are very personable for the most part, but you're on another level, and you deal with kids. So tell me a little bit about why you chose pediatric dentistry with these kids that are coming in. They're probably a little afraid of your drills. So why did you choose that, and what kind of take do you take on that?
I kind of feel like it chose me. Mm-hmm. Like my mother tells me when I was in 3rd or 4th grade, when we were supposed to shadow, shadow somebody that we looked up to, I was always interested in dentistry. Like I think from a really young age, I always had this weird interest in dentistry. I love going to the dentist myself. Like I didn't mind getting fillings, anything dental related, I loved. So I was shadowing a dental hygienist and a dentist. I think it was in 3rd grade.
Wow.
So I always was really into dentistry. So that's just, I think it's in my DNA, maybe in my heart, I don't know, it's somewhere. And then when I went to school, somebody said to me, you're gonna do pediatrics. And I was like, no way. Like that just sounds way too hard for me. And then I think as I explored all of the different options, I felt like it was the one that best suited my personality. Like I'm a kid, I love having fun. I love being transparent and honest and just having a good time. And I feel like that's the specialty where I could be myself the most, so.
Yeah.
But hold on, can I say something?
Yes. This is your office, and I'm just the host.
I go home at night, and I'm like, this is the hardest job I probably could have ever thought to do, because not only are we dealing with children, which I think in any medical or even like at your home, it's very hard to try to convince them to do certain things that they have to do, try to do the best job that you can do, and also we're taking care of parents' most prized possessions. Like I take it very seriously. Every moment a child's in my office, I'm like, this is their most prized. This is a parent's most prized possession. Like we're shaping their future. We're shaping who they become. We're shaping what they do in the world. So I think so deeply when a child walks into the office. It's not like, okay, you come into the office, okay, well you need a dental cleaning, you need a filling. Like I just try to shape the experience to be something so positive, teaching children that they can do hard things, working with kids that either have anxieties or fears. Like I feel like that's where my passion lies in dentistry. So it's not so much about pediatric dentistry, but it's like shaping the way that children, like building their confidence in everything that they do. So I know that was kind of like a long-winded answer, but for me, it's so much more than pediatric dentistry. It's not about the dentistry, it's so much deeper than that.
Well, I'm going to say 2 things. I didn't forget, actually, and I think, thank you for going on that. Like, I think it's important for us to get to know you. So 2 things. I'm going to start with 1. I think that, yes, the parents, it is their most prized possession, but one thing is you are the beginning of their experience in dentistry. And most people have, I would say probably the majority of people don't have great thoughts or experiences and don't want to go to the dentist, right? Which creates another plethora of problems. So starting that early, getting them into that understanding, hey, look, we're trying to take care of you, and giving them this wonderful experience, which the parents feel, the kid feels your energy, which is what I was going to tell you, which makes sense. That someone said, pediatric dentistry, that's your future. But I'm going to go back to something you just said, and I don't know if you've made this connection. you were enjoying your experience from a very young child age.
Yes.
And you're giving that to people, and maybe you didn't realize it along your journey, but you're like, here you are in 3rd, 4th grade, and you're like, I love this. I want other people to love it,
Right.
and that's what you're literally doing.
Right. The only thing that's different is my experience had no frills, right? Like I went to an adult dentist. There were no frills. There were no prizes. Like, it was in and out. So for me, I do feel like it was just something about dentistry. I think it's like a mixture of art and science, and just those are maybe 2 areas that I love. I don't know. It was just something innately within dentistry. But I don't think that my own experience. I think it was there were no frills, but I wanted to create frills for my patients to make it extra memorable.
So let's talk a little bit about your frills.
Yes.
Because
You're so funny.
we normally do this in a studio or in a little area that I have, and then when we were talking about it, I'm like, no, we have to do it in your office. So I'm going to give you a little bit of a tee up here, but let's talk a little about your frills and what made you. I'm just going to let you run.
Yeah, cool. So when I got out of school, I worked for 7.5 years in a very, very busy dental office. And I think when I even think of my own dental experience, like, we think of the smell of dentistry and the sound of dentistry, right?
Oh, yeah.
It's like, and then like the smell of eugenol, like it's very sterile. And I think I wanted to create something that felt more spa-like, something that felt more zen, peaceful. I'm a perfectionist at heart, so I built this space from the ground up, working with a really talented designer. I knew exactly what I wanted, and we just worked together to create this space. You know what I really wanted it to feel like? Not only did I want it to feel zen and comforting for kids and parents, but we incorporate a lot of wood in the front of the office, and I feel like it just makes you feel like home, right?
Right.
Like, we always talk about kids finding a dental home, and I really feel like when you walk into the office with all the wood, it just feels like home. It doesn't feel sterile. I don't think it really smells like a dental office. And the sounds, we have everything, like all the quietest hand pieces. Like, we really thought about all the sensory that goes into it, and it's my baby. I really, really love it, and I'm really happy that it turned out the way it did. And I also think that we maybe jump-started this aesthetic in pediatric dentistry, because all the offices that we see now, like, they're really focusing on the aesthetics and the sensory that goes into dentistry. So I'm really happy that we were able to inspire other offices and other people to kind of continue caring not just about the dentistry, but about the experience.
So it's interesting. When I first saw your office, I was like, this is absolutely amazing. And so I think was this a shell when you got it?
This was a shell. This was a dirt pile. Like, you opened the door and you stepped into dirt.
Okay, so we went through the same thing.
Yes.
So we got the shell, and that's another long story,
Yeah.
and you and I will have a longer discussion on this another day. And we're like, okay. And so I'm like, man, like, medical offices aren't inviting. Medical offices are stuffy. The few practices that we knew were free for service or concierge were very, like, old feeling, like old furniture and very, like, stiff. And I was like, the service was good though. So I was like, well, how do we, like, kind of break that barrier down? How do we become more personable? And so we thought about that, and we went, and when we started looking into the design of it, because yeah, we had our builders and stuff, but we did not at the time have an architect or anything like that. So it was kind of like on us, very startup, vision. And Dr. Miranda, like, it was like really her first job. She didn't work anywhere else for more than a few years. So when we built it out, it was like, okay, and we looked it up, and it was mainly adult, but not a lot. The focus on Google, if you were looking for, I forgot what search terms we used, but it was mainly dentist offices.
Interesting.
That had this nicer look, and I think some people had gotten on, and I've never seen pediatrics like this, and I've gone to pediatric orthodontists and stuff like that. It's inviting a little bit, so it's cute, but they're very sweet and nice, and I think it takes a different soul to deal with kids, whether it's medical or dental or anything in that world. But that was kind of it. I was like, oh, that's cool. And so we kind of did this version of, like, almost like a med spa feel, look, white, clean, not white sterile, white, clean, nice, inviting. Wow, this is nice, comfortable. And then we brought the experience together. And I think you probably had, and now I know we have a great experience, but now we're getting very granular, and I think you thought of that like really in detail. I don't think a lot of people think like that. So what made you think like that? Because you worked for someone for 7 years, and that didn't work, right? And so you can tell a little bit about it if you want. If you want me to erase anything, I can.
Yeah.
And you probably, I'm going to take a guess here. At some point towards the end, you're like, okay, if I were to do this, I would do it this way.
Exactly.
And I want to do it. And then for whatever reason, you got pushed into doing it. So kind of tell me about that experience.
Yeah, so I really think that a lot of it has to do with, I worked somewhere for 7.5 years. It was a very busy office.
Tell me what busy means.
I mean, we were seeing like 60 patients a day each doctor.
Okay.
So it's a lot of people in a small space. And it was it was like an old home that was renovated into a dental office. And there were so many things that I was just like cringe. It wasn't the right thing. It wasn't for me, right? As much as I loved, the patients, the parents, I loved the doctors I worked with. I really enjoyed working for the company. It just aesthetically, it wasn't the right space for me. So I had all these ideas for 7.5 years. I'm gonna build my practice one day. I'm gonna do it this way. I'm gonna do it this way. So when I got to the drawing board, I already knew.
Did you draw it down, or did you keep it in your brain?
No, I drew it. I mean, because when you're dreaming of something, you kind of just like want to put it on paper. Like I would draw how I would build my open bay. I knew I wanted my ice cream popsicle cart there. I knew I wanted it to look really like a popsicle cart. So I had all these ideas, and I would throw them on paper, and then I'd trash them, and then I'd upgrade, and I would just, I kind of brainstorm over probably like 3 or 4 years towards the end of my employment. And then I finally got to a point where I was like, okay, this is the time for me to do it. I felt like I was comfortable enough in my skills. I had great experience, because if I'm seeing that many patients a day, I'm ahead of everyone else. If you're working at a private office and you're seeing just, a handful of patients a day, 15 patients a day, 20 patients, I'm seeing 3 or 4 times the number of patients. So I'm just not necessarily, I'm faster than everyone else. I'm seeing more than everyone else my age. So I felt like I had so many years of experience when I left that I was like, okay, I'm ready. I felt ready. And also, one thing about me, you can ask the girls that work in my office or my friends, I am a perfectionist. I want to be the best. I want to have the best for my patients. I want to create the best working atmosphere for my girls. Like I really strive every day to, in every situation that I'm in, whether it's personal, whether it's working with my girls, whether it's with my patients and parents, like what is the right thing here for everybody, right? Like I really try to do the right thing, even if it's sacrificing myself in moments. And I feel like that has made me successful in this business. I really do think so. And in my personal life too. I feel like I've become someone that I'm proud of, and I feel like I'm kind of reaping the reward and the benefits of doing the right thing my whole life. So here I am feeling confident and happy and 40.
She's 40? Really? Got to erase that. There's no way. We'll go so off topic, but I take that
I
one.
know. We could talk about so much more. Obviously.
When there's going to be a podcast within a few years, I don't care what I say, and stay tuned for that. We started that way. That's another story. So I think, your passion, your energy, I think you put in a lot of reps. So I think that's where people, and we haven't talked about expansion, but we have, right? We've been working on expansion, and people don't want to put in the reps, but then they want the benefits. Right. They want to reap the benefits. Right. And I've had this conversation with a lot of different business people on and off camera. I did some business consulting for years, and I still do, and it's the same concept. We all have the same problems. And it's like, no, you did not put in the reps. You weren't here when it was dirt. You weren't here when I had to figure out a way to pay for all this.
Right.
All these things, which, you can get, and it's not impossible, obviously. But like, it's putting those reps in, getting that in, and then figuring out, I've done all this, I know I can do this.
Right.
So all that happens, you make the switch. Did you start building this out before you left?
I'm trying to think. I know definitely planning before I left my old office, building only after I had left. I actually think I took about 6 months off to really focus on the planning of this office.
That's interesting because I was going to ask you going from 60, opening here, you're used to this level of movement, and now it's a completely different beast that you want to create, and that's sometimes really hard to make that transition, even if you have the personality for it, because you're just like, you're used to doing this for 7 years.
Right.
And now it's like, no, I'm going to slow down.
Yeah.
And like, how do we do that? So do you think that 6 months off was beneficial to kind of recreate the vision you have for the way you want to work and the way you want this place to look and how it all came together?
It's a good question. So yeah, there was 6 months. You know, personally, I was going through a divorce at the time.
Okay.
So it kind of came right at the perfect time for me to manage leaving my old job, building this, managing the interpersonal, like the family, you know, everything that comes with a divorce. Like, I feel like that time was critical for me. Like,
you did like a mega divorce. So I talk about practice divorces. You divorced everything.
Yes.
At one time.
Exactly.
I'm not.
So yeah, no, for sure.
So you like did a complete renaissance of your life.
Yeah. So that 6 months was essential to kind of just like do everything baby steps, to manage my own emotions, to manage my children, like just to kind of start new. So I think I really needed those 6 months. I can't imagine what it would be like if I had been working during that time. I think I would have no time to really process anything. So yeah, I never really thought about it that way, but I think the 6 months were essential, and I think everything happened for a reason. I'm sure you experienced a delay with your build out. I experienced a delay. So I wasn't planning on taking 6 months. I think I was planning on taking 3 months.
Right.
But it turned out to be 6.
Construction.
I know, that's a whole other topic.
I'm having a lot of fun with one of my projects right now.
Yeah.
And I refuse to read the email because I won't be in a good mood.
Right, exactly. So you know. So yeah, I think I never intended on taking that long of a period off, but everything in the world aligned, because I think it's what I needed.
And it worked out the way it was meant to be.
Yeah, I got to fly to Denver to meet with my architect, like to really go over all the details and touching and feeling all the textures and looking at the colors. So it was like I had time to do everything I needed to do.
How did you find an architect in Denver? This is interesting.
Okay, actually, let me think okay, that's what it was. So one of my best friends from Penn, she opened an orthodontic office in Beverly Hills.
Okay.
And her office turned out beautiful. And I was like, who did your design? And she's like, Joe Architect. His name is Joe Architect. Oops, sorry. They're wonderful. Like, from start to finish, they were wonderful. So they helped me build this place.
We're gonna have to talk about that.
Design it, not build it. They helped me design it.
Things are coming soon.
Yeah.
Coral Gables build out though. Woo!
Yeah.
Love you guys.
Yeah. Terrible.
Yeah, it's so bad, and they're not nice either. I mean, they were probably nice to you.
We had great contractors, though. We
Yeah.
had really good contractors that like made everything as smooth as possible. There were some things that we just couldn't. Like, for example, that wood, you see the wood there? Do you want to know? This is the level of detail that we took when building the office. So that wood, because we wanted that color, that's sun bleach. So we would have to lay it out in the sun for however many hours, take it out, and then put it back out in the sun for more hours just to get it bleached to that color. Now, what happened during our build out is that it rained for a period of like a week, so they couldn't put it out. So then we're delayed even more. So, I mean, people never think of that. They're like, okay, they just made it that color, they stained it. But no, that is sun bleached wood. We don't mess around at Premier Pediatric Dentistry.
I didn't know you could sun bleach wood. I've heard of other sun bleach medical things, but that's different. We need to have someone on that talks about that. Do not.
No.
I'm just messing around. But that's, I and then when we're done with this, I actually want to do a tour. We're going to do a tour of the camera. So, official tour. So you thought it out, you have the experience. So you went from seeing 60 patients, and then you start building your practice. Were you busy when you opened the doors?
You know what's funny is I actually was busier than I thought I was going to be, because a lot of my patients from my old office, which was far away, wanted to follow me. So they're just waiting for me to open my office. So they'd travel up here. So I do think I was busier than I thought I was going to be.
So it's interesting. So before I walked over here to help bring Rob over, I was at the end of an interview.
Okay.
And it's internal medicine.
Okay.
They see 5,000 patients.
How?
They have a 5,000 patient, maybe it's 3, but it's 3 or 5,000 patients, something crazy. I was like, huh?
Wait, that's just their patient load?
That's their patient panel. So
is that a lot?
Oh yeah, I mean, there's 220 working days. So they came and see you annually, basically. It's so busy.
Interesting.
This is our system. This is how our system is. So 60. I mean, you probably had 12. You had like 1,500.
And there were 3 doctors there too. So
1,500. So your whole panel is like 3. Yeah, that's crazy, right?
Yeah.
So, but one thing which is really interesting, what you'll see a lot of times with physicians is if they're in one of these big systems, their reviews can be off. And if you actually, we do this for every interview, we look into the reviews, and if most of the bad ones are like, it's not that Dr. So-and-so is bad, it's that I'm so tired of the office, right? Like because you'll get like a computer and they can't get anybody, and so that's usually it. This person has, and this is, you'll know why I'm bringing it up in a second, has a million, so many incredible reviews.
Oh,
I'm
wow.
like, how?
Right.
How? And it's because of what you just said. You had a great connection, although you were flying at light speed and the people liked you. And if you give excellent care, people will follow you. They can't all follow you, but you will have enough of a following to start something great. And it really comes down to what is the experience and how am I taking care of my patients or the kid patients, and then how do their parents feel about it? You have 2 levels to deal with, right? You make the kids so happy, then the parents like, oh my God, she's awesome. I will drive to you. So you obviously did that and you came in. So what does a normal day, busy day look like for you now? Because I know you spend a lot more time. And we were talking off camera. I'm going to give you, I want to make sure we hit some of these points.
Yes.
We're talking off camera about the personal touch, the relationships you want to build, and you want to be able to take time. So this flows exactly into like what we talk about on my podcast, is that concierge kind of touch point with our clients, with our patients. So take it from there.
So, sometimes I feel like it's hard for me to put into words what I tried to develop in the office and also with the relationship with our patients and parents. I am a very gut emotional type of person. I often go off of that. So it's not like I came into the office like, okay, I want to make sure I'm talking to each parent for 5 minutes and each child, I didn't have a plan coming in. But when people walk through I love people. I just love getting to know people. I really love sharing experience, laughter, fun. Like I try to make every aspect of my life fun, right? Because that's just part of my personality. So I feel like even when people call me Dr. Rosenbaum, like it doesn't sit right with me. Even though of course I am technically a doctor. I, went to a very prestigious school.
She is a doctor, by the way.
I am a doctor. I'm a dentist. I'm a specialist. I did all the things. I succeeded. I excelled, but I still love when people call me Ashley, because it feels so personal, right? Like even now when you're introducing me, Dr. Rosenbaum, I'm like, it just doesn't sit right with me. Like I want people to call me Ashley. I want people to feel, when someone calls me Ashley, like something in my body, my heart rate might increase a little bit. Like it feels like a connection to me. So when parents come into the office, I just love connecting with people. I love getting to know them. I love to kind of see how I can help them, to see, because every parent comes into our office either with a different experience, a different philosophy, with a ton of questions. I really feel like I like to connect and educate and just feel like they can be comfortable, first off, coming here, second off, asking me any question that they want to. When I explain to parents, I often think of my own children. Okay, if Essie's my daughter, if she's in the chair, what would I do? And I often make that recommendation because it feels like, it doesn't feel like a sterile doctor visit. It feels like, hey, I'm your friend. I also have all this expertise and I also have a lot of experience. Let me explain to you why I think this is what we should do, or this is what you should do at home, or I just try to make it more personal, and I feel like that has allowed me to form really close relationships, not just with the parents, but the kids. The kids come in and I had a kid, 8-year-old girl, she just gave me a big hug, and I'm like, this is what it's about for me. It's just connecting with people and being able to offer them excellent care, because yeah, sure, I'm fun, I'm exciting, but I'm also very, I really like to do a great job, right? So it's like I try to be well-rounded. I think that sometimes even when I go to the doctor with my own kids, I often feel like there's this wall. It's like there's this wall. Okay, this is another person coming into the office. Okay, here are my questions for you. The doctor will ask me the questions. and then that's it. It's so impersonal. Medical care, healthcare has become so impersonal, and I think that's why I built this office, because I wanted to change that. I wanted people to feel like comfortable, happy, like I'm their friend. I'm also going to do a really good job and give you a great experience, but you can talk to me about anything, and I want you to feel like you can call Sarah and I just want it to feel like a home and family, and really that's kind of like number one in my office, and that's why I think that, you know, we are growing the way we are, and we're getting busier. I might be seeing 60 patients a day at some point.
No, we won't.
But
let
I
that
do
happen.
feel like that's the secret to the success, is like this culture that we've built, and it's not like a traditional healthcare culture. Like from the moment someone calls us, like you're gonna talk to Sarah, and she's warm, she's super friendly, she's very personable, she's very relatable. That's what we want start to finish. When the parents leave here, I want them to feel like, wow, that was just like seamless. The kid had like everything has to be boom, 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 perfect, perfect, perfect for me to feel successful. So yeah, I'm not sure what your question was. I think you're asking about a busy day. So now a busy day, okay, another thing that helps me with the busy days. Even though I do have busy days here, I feel like my staff, like the girls that I work with, are so well trained, so kind, so experienced, that our busy days don't feel overwhelming. I'm still able to speak to the parents. We're still able to provide the service, even though like we do it quickly, right? We do it quickly. We still go over all the topics we need to go over. We do everything we need to do. We give them a great experience, start to finish. But my girls are so well trained. And we've been working together for a long time now. You know, I have someone that I used to work with here as my main assistant, and it's just like, it's just been seamless. It's been really, really good.
How did you get that level of output? How did you do that? Did it start that way? This is not common.
Okay,
So
I'm a little crazy. Okay, you ready to get to know me? Okay, so before my office opened, I actually hired all my girls, and we started working before the office was open.
Okay.
So we created all the documents. We created, okay, the patient flow. That was very important to me. So the first day we opened our office, our first patient, it looked like we had been open for years, because we had a patient flow. We knew when they walked in, what were the statements that we were gonna say to them, right? Welcome to our office. We're so happy you're here. Like, we came up with statements. What do we want? How do we want someone to feel when they walk in? Who are you checking in? Okay, all right, go sit down. Like, that's what.
That happened to me at the pharmacy the
that's
other
what I'm
day. I was
saying.
like, I hate this place, but it's so easy. I'm gonna keep coming.
Know.
Like, I'm just gonna put up with this mediocre, angry lady that's, who are you?
Yeah.
What are you here for? I'm
so
like,
that's what I'm saying. So we already had this established. When the patient walked in the door, there were 3 statements that you could say to the parent when they walked in. Here's another thing. We're not concierge. Like, we're not fee for service. Like, we do have patients that are fee for service, but we're in network. We participate with insurance. I wanted to be able to give access to as many people as possible, access to our office to get this care that I think is the best in Miami. So that was really important. But when we're talking to somebody on the phone, we don't say, what insurance do you have? We do not say that. We say, do you have any insurance that you would like us to verify for you? Right. We're very completely different. Like, we're very strategic, and we had this before the office even opened. So we really paid attention to the details.
How did you know to do that?
Because I'm crazy. I don't know.
It's not that you're crazy.
I don't know. It's just that I had this dream that I had been dreaming about for 3-4 years.
Did you work anywhere else before becoming a dentist?
No.
No. This is so uncommon. That's why I'm trying to like figure it out.
Because I think if you got to know me, you would understand the way I work. Okay. Like, I'm really disciplined, and that's why I'm sitting here, because I feel like that's discipline, hard work, care, kindness. Like, those are the things that like build a successful person. Like, honesty. So anyway, so that's what I think of the secret to our offices is, like, when you came in on day 1. We already knew we already knew the flow. So the patient would come in, I would tell my girls, hey, you are the tour guide. So you're gonna bring them in, you're gonna sit them, these are the things that we say to them. Like, everybody knew what they were doing. The flow was established before the office opened. And I think that was kind of like the secret sauce. We didn't look like a new office.
We usually do it, so that's, if you want to touch base on this, please do. very brave to not know if one person is going to walk through the door. You hired a full staff.
Full staff.
Right? So, you know, we hired a scale, like most companies. We do it the other way, right? So you have a full staff, you have the full experience mapped out, which is amazing. It's really hard to reverse it, and I can tell you from personal experience, to reverse that and to understand that, because you go from seeing one person a day to 10 persons a day, 10 people a day, and that's really busy for us. And then you get a bunch of phone calls in between, and so you try to, okay, how do we make this better? How do we make this better? How do we do that? Or a lot of times in medical, and I know you take insurance, but in medical concierge, you're giving concierge the experience.
I think we are.
You are. What happens is, you know, someone has 2,000-3,000 patients on their panel, and they're like, I'm done with this. I don't want to spend 5 to 10 minutes with you. I'm going to keep 200 of you and charge you X amount of dollars. But everything's kind of the same, as they have more time now. Nobody changes. They just appreciate the difference in the care they're getting and the time they're getting. And so I think there's some, you know, there's a little bit of a movement towards that, but I don't think a lot of people think this out. And a lot of doctors don't understand this at all. So, and that's why I asked you, did you do something else? Because I would have thought you did. Because most of you just school. I'm a doctor, I work. And then some of you will be like, I'm working for myself, right? So I find that to be just absolutely fascinating. I think even with that, if people got to know you or get to see this, they're gonna be like, shoot, I'd love to like just shadow you for a day and see how you do it and what you do. And have some ideas around that for scalability for you in the future, but I find that to be like, this is just not the norm.
Really?
No, this is not the norm. This is your norm. This is not the norm.
Interesting. I didn't know that, right? You have more experience speaking to other like physicians and dentists, but.
I do, and I did 10 years of medical sales. I know hundreds, if not thousands of doctors. And it's like, I've seen it all. I've seen the hospital systems, I've seen the large practices, I've seen the practice divorces, I've seen all of it. I've seen acquisitions, I've seen it all. And the flow is good enough, right?
It's easy to be good enough.
Good enough, and good enough is here,
right.
and then just being better makes you outstanding, right? And then it's like, well, are we outstanding, right? And that takes some personal reflection, right?
Yeah.
And so, and it's very difficult when I'm working with some clients that I'm consulting, being like, you're not really outstanding. You have some outstanding qualities. You're an outstanding doctor. We need to make this all outstanding, right? So it's not the norm, and that's probably why you have the success you have and the following you have, and it's all worked out. And it's really interesting because a lot of people will get stuck in the business stuff and not think about how does my client or patient feel, and that's at the end of the day is the most important thing.
Most important thing, absolutely. Right?
And then so not only have you brought this fun, happy, welcoming environment, but you bring the personality, and you've thought about from the phone call to the exit, which is really rare. I almost want to erase this because I don't want anybody else doing it. I'm just kidding. Go for it. Or you can call me or her, I guess, at this point.
No, but I think it's good. Like, I started off doing what I felt I needed to do, but a lot of people have reached out to me, like a lot of young pediatric dentists, hey, I want to open my office. Like, can I come to your office, or can I ask you questions? And I've guided people through the opening of their office. So I'm happy to help people, you know, even if they're in Miami. Like, there's somebody that opened up like kind of, not that close, but close. And she like did a lot of the things that I have in my office, but it doesn't bother me. I want everybody to be able to give a great experience and like for the kids to have access to something that could be, you know, a different dental experience for them. So. Certainly reach out to me if you have any.
And I think that's important too. The better we do in our fields, the more people are going to hear about it, and there's enough patients. And
that's what
people are so catty. I've had a couple run-ins in the last month, and I'm just like, dude, we're good. Like, have fun. I'm like, like, I don't really care.
You know how I feel about it? Like, a lot of people I would have referring other doctors, orthodontists, or other pediatric dentists, because there are services I don't provide in this office. I don't do sedation, so I don't put kids to sleep here. I do everything awake. So I'll often refer to other trusted pediatric dentists in the area, and they'll say, oh, don't worry, I'll send them right back to you. I said to them, if they're happy with you, if they feel more of a connection, a comfort, if they want to be with you, I'm totally fine with it. I think everybody needs to be where they want to be, right? So in a way, I'm like, I feel like we do provide a great service. We bring great value. We bring great experience. And if this is the right fit for you and your child, that's great. But if you feel comfortable going somewhere else, like I truly have no problems. Like I know a lot of people are like, oh, she's getting more patients than me. I'm like if you want to come here, I'm so happy to have patients, but also if you feel comfortable somewhere else,
that's okay.
That's totally fine too, right?
That's okay.
Like
exactly.
That's totally okay.
Exactly.
Like I don't have any of that in my body at all. So that's good. And it's kind of like in relationships too. Like if you're with someone where you're like trying to fight to keep them, like stay with me, like they find something else better than them, let them be, right? Like that's just kind of like how life, I think, should be. Anyway, that's a different topic, but.
Makes me want to ask a question though.
Okay.
Have you ever had patients that you don't want to stay?
Not necessarily. Okay, so here's another thing about this office is that, and about me, is I feel like we really do draw in the patients that like maybe need a little extra TLC. So we do definitely have challenging patients, but it's not that I don't want to see them, because I'm happy to see them, because to me, like when we can change them from not even being able to walk to the back of the office to sitting in the chair, like that's huge. Yeah. We do have challenging patients. We do have, and I'll speak candidly, like the parents in our office are amazing. Like they value what we do. They are so kind. We do have like a couple really challenging personalities, and even for me, I feel like I can get along with everybody, and I feel like I'm very understanding of other people's backgrounds and the experiences and how that shapes who we are and what we say and how we do things. But like, I definitely have a few parents that when they come in, I'm like a little nervous,
right.
and I'm very confident in what I do, but I do have a few parents I can think of, like a couple of dads that I get very nervous around because of like things they'll say, or like, I don't know. There are like a few people that make me a little nervous.
I think there's like
they'd be like a little bit rude.
That's where we're going. Yeah, exactly. Like I'm and I wonder about that too, right? Like, I think in the beginning when you're being a little scrappy, like you're like, okay, let me put up with this.
Yeah.
Let me do what I can to keep you happy. There's just some people aren't happy, and I'm like, dude, why are you so unhappy? You're getting this good service. It's never enough. You're always, like it's like.
I know.
And I'd like to at one point get to the point where it's like, like let's have a conversation. Like, and we've been doing this for a while, so like there have been a few times, not even a handful, that patients were super rude to our staff or even the physician or something, and there's been a very firm conversation. For the most part, everything clears up.
Good.
There's a few though, I'm wondering, I'm like, should it's almost be better for them to go elsewhere,
right.
and I think for the most part we're very understanding. We do our best. We're always doing our best, and some people are just never happy, and it's very hard. And sometimes because you said it, like you're coming in and we're meeting your demands, we're highly qualified, and we're doing everything we can. And if you think we're not up to par, let us know, and we're going to fix it. Right. We'll get better.
Right.
But you're still not happy. It's like you're creating so much tension when your name's on that schedule. It's like, And so I just wonder sometimes what's the right answer there? But it's kind of interesting too, over time and more recently, some of those people have weeded themselves out. And like, okay. And it's not like, it comes back to what you said, no, you want to go somewhere else? That's okay, please.
Right.
No big deal. And it's been some of our most complicated, most difficult clients. And I'm like, this is actually okay. Like, as long as you're doing a great job, you're going to have more inflow than outflow, and that's really important. Right.
The hard part for us, and when I think about it, about having those conversations, is that it's not the patient, it's the parents.
Right.
Like I don't want the patient to suffer, because I don't want the patient to go somewhere else, because I really do think that our service here is like excellent. So I want the patient to stay, as long as there's no like crossing boundaries, I think we're fine. But I definitely have not a handful, like maybe two that I can think of, where I'm like, if you're not
be nicer.
Be nice to us.
Be nicer, I swear. Everybody's doing their best.
Nothing will happen, but still.
I don't know. We're gonna have an off-camera conversation about this. It might happen. Be nice to her. Yeah, no, it's interesting. And then there's some things I'm like, nowhere else in your life would you act this way, right? Like,
right.
Or
so maybe they do. Or maybe they do. Or maybe they have a bad day, multiple days. I don't know.
That's okay. Multiple all the time.
More than one day. I don't know. But another thing in dentistry that I don't know if you experience this in medicine is, there's a lot of like hot topics in dentistry. So like radiation from X-rays,
right.
like filling materials, nitrous oxide, laughing gas, like exposure. Dentistry is a hard field because we're given this many tools. That's it. Like there's only certain things that I can do, that I can use to fix the problem. So sometimes it's really hard because, listen, I can't see how to fix this tooth if I don't have an X-ray of the tooth,
right.
because I can only see so much of it. So those are a lot of the challenges that I face on a day-to-day. And then, like, for example, if like I have like a really hard kid, like a 4-year-old kid that has a really deep cavity, like I said, I don't put kids to sleep here. I really try to teach them how to get through it. 4 is a tough age, but I usually like to use a little bit of nitrous oxide. So if a parent's not allowing me to use nitrous oxide, I'm like, ooh, so I'm like, my hands are tied behind my back because I really want to do a good job. I want to give them a great experience. I know the nitrous oxide really does help to kind of just help the kid kind of feel more calm. And to be less sensitive to a lot of the sensory input that goes into getting a filling done. So sometimes I do feel like the profession's hard because of all of the just like the heated, the fluoride is now a huge topic, and then the radiation, and then like tongue ties, like everybody wants their tongue tie released. Like there's so many Googleable things in dentistry. Yeah. So that's another challenge. So anyway, pediatric dentistry is hard. You have to really love it to go into it because it's very challenging, and I'm tired at the end of the day.
So coming back to that, it's like, dude, this is like getting to becoming a dentist or a physician is very, very hard, and you're doing your best. Even people in these situations like I talked about, seeing 2,000 to 4,000 patients a year, like they're doing their best within the facility, within the confines that they have, and it's just become very complicated and very difficult. And now with all these things coming out that we've been using this, dentists have been using some things forever, for like 50 plus years, and there's some things that are super antiquated, and some things it's the same drill, it's just less noisy.
Less noise,
but it's still the same tool. But yes, and some of those things have become a little bit better. But we go through the same things. In fact, yesterday, I want to say, it was a New England Journal of Medicine, and it was an opinion back and forth between 2 physicians, and it was around, this is still a hot topic to a certain extent, and there's hot spots that I think get a lot of press for this, but I don't think this is the norm. It was the MMR vaccination.
And autism?
And it was just, the parent doesn't want to do it. Do you see the patient or not? And it's like a 4 or 5-year-old.
So hard.
And it's like, and so you go back and forth, but it's like, okay. And I hear that, and people are freaking out about the vaccinations, and a lot of pediatricians that we refer to and know and really well, they usually space them out, and we still don't know. Like, we still don't know, and there's a million things we don't know. And same probably as what some of the topics we're talking about, right? So we're doing our best and if the data changes, I'm sure we'll change, right?
Exactly.
And so people are coming in with some really hot topics, and it's like, dude, no, there's no data on that, and depending on, we'll manage it depending on what it is. But that was a really interesting back and forth, and then at the end of the conversation, I'm not a doctor, right? So I'm like, well, wait a second, like, what's the downside? That patient comes into your office, let's just say it's like an office like this, there's 30 other children, they haven't received their vaccine yet, it is super contagious, and it can shut down organs. I'm thinking to myself, I'm like, man, that's a very hard place to be in, because the doctor wants to take care of you, even though you decide not to. This is a disease can be not dealt with by a vaccination. I'm not an anti-vaxxer, and to each their own. But like, if your kid gets this, they could die, and it's very contagious, right? So I was like, man, how can you walk that person into a room full of kids that are 0 to 18? Most likely the 3 plus 2 to 7-year-olds are vaccinated, but like, what about the 3 babies that just came in.
Right.
Like, it could be a nightmare. And so, like, these are the kind of topics that are hot, and depending where you live and what your algorithm says, it can be pretty complicated.
Absolutely.
So that was a conversation I had last night. I was like, wow, that's very interesting.
I mean, that one's more serious than I think the ones that I deal with.
I mean, still, we're thinking about how do these toxins affect us? How is it going to make my kid in the future? All these things, and there's not a super right answer right now, and we're all doing our best. And we were talking about microplastics.
I was just gonna say, that our white fillings, everyone wants white fillings, not silver fillings. White fillings are made of plastic, like they're a moldable plastic. So it's like the tools that we have in dentistry, like they're not perfect. You have to kind of like take the best one.
So that's the other conversation, and there's no getting away from it. And I have to look this up.
You can do like a there is an alternative, but it's not as aesthetic. It's not as polishable. Sometimes it doesn't stick as well. Sometimes it wears. So it's like there's no
feature, like benefits and downsides, right? Like
exactly.
So, and we're talking. There's no really getting away from it. And so we try to minimize it where we can and tell clients to try to minimize it. But like, there's some talk about it crossing the blood-brain barrier, which is very difficult to do for a medication.
Right.
I'm like, dude, this is crazy. That's the world we're in right now. And so, like, we do our best. And then I, of course, I'm a jokester, and I was like, because, and we did it on purpose. And I mean no offense, by the way, but I joke about everything. And I was like, from plastic to metal bottles. I'm like, the next thing is metals in my bloodstream. Jesus, like there's no getting away from it. And so, we have a lot of those hot topics too. It's really interesting. And and I think, but because you get to spend time and you get to talk to them, you probably make them feel comfortable with that outcome. We do the same. We're here to listen to you. Everybody has, information's coming out faster than we can study it. And we'll get there, and we'll take care of you, and we'll tailor.
Right.
So how long did it take you to feel like this is exactly what I wanted? I crushed it. I have become a successful solo practitioner in pediatric dentistry.
I mean, I don't know if I'm there yet. Like, I feel like we're doing a great job. Like, I'm really more about every day doing the best we can to be that. I don't know if I say, I crushed it. Yeah, I'm the man, or I'm the woman. I don't feel that way. I do feel, from the feedback from patients and parents, I do feel like we're doing a great job. But the job's not over. Right? Like
when will it be over?
I don't know, and that's another.
I don't think it will for you, and that's why I was asking.
Yeah, I don't think so. It's funny because I read this quote about like when will, like maybe if you just stopped trying to reach for more and more, that you would just find kind of like happiness in the little life that you've created, and you'd have more joy in the moments. Like, I'm definitely not a thrill seeker, but like I like to push myself. Like, I like to push myself as hard as I can. And that's another thing I feel like that has helped me become a good pediatric dentist, is like, I will, if I have a challenging patient, I'm like, let's do this. Like, I feel like a thrill, like I can do this. And like, I push myself as far as I can go. And I feel like when you push yourself as hard, you work yourself super, super hard, you grind, you see the hardest patient, you do it in the chair with them awake, you teach them how to do it. Like, when you're doing hard things, all the rest is so easy now. So like, I have these hard things that I do, but it pushes my threshold here. But guess what? Most of what I do is here, and it's so easy now, right? Like, I have a hard patient, and my girl's like, oh my gosh, that was so challenging. I'm like, it wasn't too bad, because I've already done all the hard stuff, right?
Right.
So like, this is like a breeze. And I think that's a life hack. Like, even with my kids, I'm like, how hard can I go? I'm like, I'm gonna wake up at 5:30, I'm gonna get everything, I'm gonna get myself ready. Like, I like to push myself to see how far I can go, because then normal life is so easy. Like, waking up at 7, like, if you can wake up at 5:30 and do all the things, most people wake up at, I'm guessing, 6 or 7. I don't know, you probably wake up at like 3. But I like to push myself.
Story.
I like to push myself as hard as I can, because you know how far you can go, but most of your life is really in this like safer zone, and it just makes, for me, life easier, more enjoyable. That's a life hack that I think everybody should do. Like, don't be afraid of challenge. Like, go for it, push yourself as hard as you can.
Yeah, I think we're so accustomed to comfort and being safe.
Yes.
From a very genetic, great book on this. We'll talk. Yeah.
Okay, we'll talk after.
We'll talk about it after. But it's from we're here to be safe. run away from dinosaurs, and then only go out to get, berries,
right,
and try to kill a dinosaur. And going through those challenges makes you sharper and better, and it makes like a resilience. Putting yourself in a situation, if you don't like roller coasters and you go on and you go to Universal and you ride every roller coaster, you may not like them, but you're not going to be afraid of them.
Right.
Right. It's like deep immersion.
Yes.
And so those challenging things would push you, and it makes everything else. And there's another quote that I absolutely love that rides along this. And he was like the commander and a Navy SEAL, Jocko Willink. He said, discipline equals freedom. So as you stay disciplined and you can handle things that are thrown at you, and you just keep on cruising and pushing forward, it'll just become easy, and it allows you to be more creative, and allows you to handle all these things, because
more mental freedom.
You have everything going in a certain direction.
Yeah. I want to relate that to something that I've observed in my office with my own kids, and even in the last office. One thing that I see, and I know it comes from a good place, I also do it with my own children, is like parents trying to mask their kids from any challenging situations. Hold on, I want to talk about this, because
this is good.
This is a major problem with kids these days, and I'm talking because I'm a parent and I have 2 kids, and I probably do the same thing to them until I kind of realize, listen, you can't. We have to allow our children to go to do hard things. We can't put them in a bubble. I'm going to give you an example. I mean, this might be a little extreme, but like sometimes when kids don't like coming to the dentist, either like parents, or I'll have a parent come in and say, oh, I don't brush my kids' teeth because they don't like it. Okay, so like we're not brushing. This is just like a really like dental related, but like we need to make our kids go through hard things on their own, because we need to come out of the other side. If we put our kids in this little bubble and we never expose them to anything hard, they will never be able to do anything on their own. Like another thing is, like when kids have sensory aversions, like they don't let us either brush their teeth, like everybody has different sensory, sensory processing, but we often have kids that just touching their tooth sparks like a very major response, right? So what's the treatment for that? It's exposure to those, that sensory input in small amounts, right? So we can desensitize them. We have to start desensitizing our kids to the world. Like we have to allow our kids to go through hard things, because we're not, right? I think it's maybe like the social media, like we want the best for our kids, we want to care for our kids. I'm the same way with my own kids, but if we don't allow kids to deal with issues and go do hard things, like I truly feel like we're not giving them the skills like to live a good life. Like my son, for example, not to expose any of his medical history, but like he has challenges on a daily with things. But guess what? This kid is gonna live a great life because he's been through so many like social challenges, personal challenges, like so many things that he's already overcome on his own. And I just feel like he's gonna be he's like a more well-rounded person because he dealt with all these social situations.
He has a wider array of things to pull from, because he's not staying inside this little bubble. Lots of tools to handle different people. So I go through the same thing with mine, and I can't say that story because we've got a couple months.
Yeah, be careful.
Yeah, we'll talk about it in 3 months.
Yeah.
You probably picked up on that, but I'll use my own example. And so we were talking about this a little bit earlier, and I volunteer coached water polo, and it's gotten more and more complicated. And you have the old school parents being like, drown my child. Obviously not literally, but teach them how to be tough, teach them how to be resilient. It's a very physical sport.
I believe it.
You're gonna get hit. You got to figure it out. You got to keep playing. People get nasty. People try to get you out of your game. And so, nobody's saving you in the water, right? And so you have that. And then as time has progressed over the last decade or so, there's another group of parents that are like, you can't talk to my kid that way. You can't do this. You can't this. And it's like, dude, it's like, what do you even say to this kid?
Right.
So now you have half the kids that don't want to work hard, half the kids that are like, why would I work hard if they're not working hard? And this kind of sucks. And it becomes very hodgepodge, and you have to watch out what you say now and all these things. And so I've had the luxury of one of these recently to see another high school practice in the same facility, and I know the coach, and he's super old school, and these kids are disciplined. They don't do it, they get out, they get pulled. Doesn't matter if you're the best player, the worst player, it does not matter. Boom, all private schools. And it's like they're being so finessed. And if you look at historically, and our kids are going to go to private school, most likely, the third generation loses it all, and it's because we've softened everything.
Right.
There's a really beautiful quote about that, like, hard times make, hard people, and good times make soft people, and soft people make bad times, right? So like, as the softer you get, the less resilient you are to what people say and do. And
that's what it is.
And there's too many people on this earth to control everything, and too many things that can happen to you, and things get thrown at you, and you have to be able to handle them. But if you're not handling any adversity, and so listen, a lot of people I interview, we're all in really good places, and we've worked hard to get here, and we have a different set of challenges with our children because they have much more.
Right.
And maybe they didn't change generation to generation, but I can tell you, it's like, okay, so how I had a lot of adversity. I'm like, dude, how do I create some adversity so they're stronger?
Right.
And last night I was like, I got the, oh, help me. And I'm, oof, I will help all day long.
Yes.
I was like, what? And I looked at it and I go, look, it's here. Yeah, but help me. I was like, no. I flipped 3 pages. I left the book there. I go, do it.
I know.
Now, once they read all that, they understood, and I was like, okay. And then it was like dot, dot. And let's help you understand, because they weren't understanding the way it was brought up to them in the class. And I get that. And so, that's another topic. But it's just like, no, you have to figure it out.
Yeah.
I call FIO, F-I-O. Figure it out. Right? Figure it out.
Yeah.
Like,
if you're not here, how would you handle, if the parent's not here, how would you handle the situation? That's what I say to my kids. Like, if I wasn't here, what would you do? Yeah. And whatever that is, go do it, right?
Exactly.
Like, the thing is, it comes from such a good place. Like, parents are just trying to be the best parents and maybe provide a life for their kid that they never had, or like maybe, they were missing out on things in their childhood, and they're like, I want this for my own kid, right? Like, I don't want them to have a childhood like I had.
Yeah, and there's something great there.
It's coming from a good place.
Like, my kids are not going to go to the schools I went to. It was bad.
Really?
I was getting
Where'd you go? Here in Miami?
Yeah, I went to a magnet program that was
bad.
Yeah, they used to just beat us up.
No, they didn't.
Like, swear to God, made me.
Okay, well, I wouldn't go that far.
No, of course I wouldn't. But I kind of want to be like, here's a day in this school. You have it really nice.
Yeah.
But what good came out of that? Like, I learned how to run really fast. I really did. I was always fast, but boy, can I run fast. I'm thick skin, and I don't let people get to me.
I don't mean that extreme, but I think just allowing your kids to do things on their own. Like, my son was having an issue with someone talking about a medicine that he was taking, and I was like, talk to him about it. Like not duke it out, but like, tell him how you feel. Like, I'm not gonna go in and just like handle the situation. I'm not gonna call the school counselor. Like, I really don't want to do that. Like, try to manage it on your own, right? Like, I feel like he has the skills to do it. If I didn't think he had the skills, if he was little, I get it. But like, you're 10, you're a smart kid, you communicate very nicely, like, you can do this, right? You have the confidence in yourself where you can speak up for yourself, right? Like, you can handle this. And I think when kids do things on their own, they also build more self-esteem.
Correct.
Anyway, that's a whole thing we could talk about.
And it keeps their creativity.
Yes.
The kids are super creative.
Yeah, for sure.
It's the world that starts, think about what they like, what they look at. They look at the sky. Oh my God, it's amazing.
Right.
There's wonder. Don't steal their wonder. But kids need to be able to do hard things.
Yeah.
Let your kids see the dentist. You don't want them to have rotten teeth.
Go to the dentist. Or
I threaten that all the time. I'm like, dude, you're gonna have rotten teeth. You can't eat cheeseburgers, bud, with rotten teeth. And I'm like, okay. I will say, go brush your teeth again right now. Your breath smells. And even if it's not bad, I'm just like,
you're just like forcing them
to do a better job. Do a better job. You know? So I don't want to pay for your freaking fillings unless I have to.
Oh my gosh, that's funny.
But yeah, so it's.
So that's a whole other topic.
But anyway, so I want to say something like, you've done great. I know you're doing wonderfully well. You're just your own personality that pushes you to give the greatest experience to the patient is also what doesn't allow you to say that, and that's fine. And I think that kind of pushing yourself to continuously give that experience and be the best dentist and person that people want to see and come
Right.
back to and are comfortable with is what makes you there. And as long as, like I said, you can continuously taking care of that one person at a
Right.
time, and for you it's kind of almost two, but one, your patient and their
Right,
families.
right.
And we deal with some of that too. Like that will just continue to go, and one day we'll just sit and laugh and be like, yeah, this is awesome, but I still got to keep going.
I still got to keep going. Yeah, there's no end. There's no end in
But
sight.
yeah, I want to. I'm going to sign this out. It's been a wonderful talk with you. We covered a lot of topics. We're going to cut this out, and then Rob, I think we should just do a quick little tour so we can do some clips of your gorgeous office after we put these chairs back. Thank you for joining me, Dr. Rosenbaum. Ashley.